Welcome everyone to today's webinar on the Filipino Nursing Diaspora Day, brought to you by the Filipino Nursing Diaspora Network, hosted by the World Continuing Education Alliance. My name is Samantha, I work with the WCA, and I'll help you with any technical questions you may have in the chat. For those joining us for the first time, WCA is a social impact technology organization dedicated to using digital tools to help healthcare professionals grow their skills, improve care, and support healthier communities worldwide. If you have any questions for our speaker today, please post them in the Q&A section and we'll address as many as we can during the discussion at the end. And now I would like to hand it over to our esteemed moderator today, Mr. Dennis Amando. Over to you.
Thank you very much, Sam. Good morning, good afternoon, good evening, everyone. And it is my pleasure to welcome all of you to the 2026 Filipino Nursing Diaspora Day webinar. I'm Dennis Amando, the Vice President for Engagement of the Pacific Nursing Service Organization, and I'll be serving as the moderator for today's session. This event is brought to us by the Filipino Nursing Diaspora Network, St. Paul University Iloilo, St. Anthony's College, Pacific Nursing Service Organization, and the World Continuing Education Alliance. Today's webinar centers on the theme, Empowering Nurses to Lead, Innovate, and Improve Patient Outcomes through Technology. As healthcare continues to evolve in an increasingly digital and interconnected world, nurses are being called not only to adapt to technological change, but also to actively lead innovation, shape healthcare systems, and improve patient outcomes through informed and compassionate practice. This session serves as an opportunity for learning, reflection, and dialogue as we explore the expanding role of nurses in technology-enabled healthcare. But before we proceed, allow me to share a few reminders for everyone. The participants, you are encouraged to use the chat box for questions, comments, or reflections. And of course, we are also encouraging you to use the chat box to introduce yourself, where you're from, which country, and we are requesting everyone also to maintain professionalism and respect during the course of the webinar. And there's a Q&A box in the Zoom, and you may send your questions on the Q&A box, and these questions will be accommodated during the open forum after the presentation of our resource person. So for any concerns regarding attendance and certificates, kindly follow the instructions provided by the team, and there will be announcements on that. Having said that, to formally open our program, let us welcome the Dean of Nursing of St. Anthony's College in Antique, a respected leader in nursing in the Philippines. Let us all welcome Dr. Aris Kendall Bungabong for his welcome message.
Thank you, Sir Dennis. Warm greetings to everyone joining the 2026 Filipino Nursing Diaspora Day webinar. On behalf of St. Anthony's College, I extend our sincere appreciation to the Filipino Nursing Diaspora Network and its partners for organizing this important gathering that brings together Filipino nurses from across the world. Nursing education today faces both unprecedented challenges and remarkable opportunities. Technology continues to reshape healthcare delivery, clinical education, and patient engagement. As educators, we have a responsibility to prepare future nurses not only with knowledge and technical competence, but also with leadership capabilities and adaptability needed in an evolving healthcare landscape. The theme of today's webinar reminds us that innovation and compassion are not competing priorities. Rather, they must move together to improve patient outcomes and strengthen health systems. May this event encourage meaningful dialogue, professional collaboration, and renewed inspiration among Filipino nurses globally. Congratulations to the organizers, and thank you for your commitment to advancing nursing leadership and excellence.
Thank you very much, Dr. Aris Bungabong, for your inspiring and meaningful welcome message. Your message reminds us of the important responsibility shared by nursing educators, practitioners, and leaders in preparing nurses for the realities and opportunities of modern healthcare. So I am looking at the participants list, and apparently we have a lot of participants coming from all over the Philippines. So welcome everyone. And for those who are joining us from outside of the country, also welcome, and we hope we will have a very meaningful learning experience today. So at this point, it is my distinct privilege to introduce our resource speaker for today. Our speaker is a Filipino-American nurse leader, a healthcare executive, and entrepreneur whose career reflects innovation, resilience, and a strong commitment to advancing nursing practice. A first-generation immigrant from the Philippines, he has built an influential career at the intersection of clinical leadership, healthcare technology, workforce development, and systems transformation. Our speaker currently serves as the co-founder and chief operating officer of Carexa Incorporated, where he focuses on leveraging technology to reduce nurses' workload, strengthen early detection capabilities, and improve patient outcomes through solutions that integrate seamlessly into clinical practice. Our speaker previously served as Associate Chief Nursing Officer at Harborview Medical Center, the only Level 1 trauma center serving the states of Washington, Alaska, Montana, and Idaho. During his leadership tenure, he played a critical role in guiding the organization through the COVID-19 pandemic, achieving Magnet designation and leading a major transition from Cerner to Epic. He also served as the founding Chief Nursing Officer of NPHub, where he launched NPHire, the first nurse practitioner-specific job board supporting workforce development and primary care access. Our speaker holds degrees from MIT, Harvard University, and CSU Fullerton, and continues to contribute actively to leadership and service through nursing advocacy organizations. Today, he will guide us in exploring how nurses can lead innovation and improve patient outcomes through technology. Ladies and gentlemen, please join me in warmly welcoming our resource person, Dr. Joseph De Veyra. Dr. De Veyra?
Hello, good morning, everyone. It's evening right now in Seattle, but it's such an honor to speak with you all today. Let me show my PowerPoint right now. Give one quick second. Can you see my PowerPoint?
Yes.
Perfect. So the title of my talk today is Empowering Nurses to Lead, Innovate, and Improve Patient Outcomes Through Technology. But just a little bit about me. I have a doctorate of nursing practice from Cal State University, an MPH from Harvard, and an MBA from MIT. Wherein my project on stroke innovation won the best project out of 120 entries. In my career, I've also served as the California Medicare Quality Improvement Organization Executive Director, wherein I had the oversight of the quality metrics of around 314 hospitals. I do want to say that I started as a caregiver. So I actually climbed the ladder of nursing. I started as a CNA and as a licensed vocational nurse, and then eventually becoming an RN. Also, I was the Associate Chief Nursing Officer for University of Washington called Harborview Medical Center. I'm not sure, has anyone heard of the show Grey's Anatomy by any chance? Feel free to comment or like if you've heard of it. Okay, I see a lot of... So the hospital that I led during the pandemic was the inspiration behind that show, Harborview Medical Center, because it's the only level 1 trauma center in 4 states. And it's important to note that Seattle was ground zero for COVID-19. So it was a very difficult period when I led that hospital. And today I will be speaking about those experiences. And also, I want to say currently I'm the co-founder and chief operating officer of Carexa, which is a remote patient monitoring company wherein we empower clinical teams and patients to monitor their vital signs at home. Here are my key objectives. Examine how leadership pathways from entry-level roles to executive positions demonstrate the long-term impact of investing in and empowering nurses. Analyze the key leadership lessons from managing a level 1 trauma center during COVID-19 and the implications. And also identify practical actions for nurses, leaders, and institutions. I really want this to be an actionable webinar for all of you. So I will really share some tips on how to advance your career and leverage technology to improve patient outcomes. So I want to just paint the picture during COVID-19. So we were the safety net hospital during COVID-19. And we also transitioned our hospital from Cerner, which is an EHR, to Epic in 2021. During that time, it was very difficult because frontline engagement when a lot of your patients and staff were dying. In fact, it was very difficult for me because I remember I was the administrator on call and our morgue was actually full and I had to go on a Saturday to actually move around the bodies because our morgue was full. And for me, that was very difficult. And I'm just glad we were able to emerge from it. But that was the key challenge. How can you shift the perspective of nurses from burnout to going back to improvement and innovation? And also, it was the perfect storm because we had a lot of staff members who got sick. We also increased our new grad onboarding from 50 to 200 per year. And here is the key agenda that I will be sharing. Obviously, I shared about the setting. I want to share about the program called Quality Champions, wherein we empowered frontline nurses to audit, innovate, and educate frontline staff. And also, I want to share about quality improvement. But a lot of this as well is aside from having the strategic techniques, you also need to build community through meaningful recognition. So that is what I will share today. And in the end, I'll share some leadership pathways that hopefully you can replicate in your careers. I also want to share that one of the critical factors or key achievements of the hospital during this time was magnet designation. Magnet designation is the highest level of nursing excellence accreditation that you can achieve in the United States. And I believe a couple of Philippine hospitals have achieved that magnet designation as well. So the pressure was on. So what is the Quality Champion program? The Quality Champion program is we designed for frontline nurses to have protected time to conduct audits, render education, and pilot projects to improve nurse-sensitive indicators in July 2023. So nurse-sensitive indicators include pressure ulcers, cavities, central line infections, and falls with injury. So initially, we started with 5 units. So we had 2 quality champions, 1 day shift and 1 night shift. And we fostered guiding principles such as fostering an all teach and all learn philosophy and content taught by domain experts. And here's just a little bit, just to give you our first cohort, wherein we focused on specific quality metrics on each meeting, such as CLABSI and pressure ulcers. And also the beauty of this as well is that, for example, for HAPI, we had the pressure ulcer injury team to educate. And for CLABSI, we actually had infection preventionists teach. And we also tried to structure the day wherein we had quality champions auditing central lines, having the Braden scale, which is a HAPI prevention tool, doing CAUTI audits as well for urinary tract infection. And of course, it also goes back to hand hygiene. And we also empowered them to conduct quality improvement projects such as posters, binders, and labels. And also, a lot of it was data analysis. but we want the data to be actionable as well. So at the end of each protected day for their quality champion leadership, we also wanted them to communicate with the manager or assistant nurse manager. And one of the key things as well is that we have in the United States a unit practice council wherein nurses can actually lead innovation and improvement in the unit at the grassroots level. And what we've done is we actually created a technology platform wherein we have a quality champions tracker, and we made it fun as well. We used Microsoft Teams to have a Teams chat, and then we asked them what were the highlights, things that went well. So we created the community, a quality champion community for them to innovate and improve quality metrics. And this is just one of the key techniques that we use was that when we held meetings for us to go back as a community, we met in a U-shaped room so that everyone can see each other. And I think that just helps with regard to engagement. And another key thing as well at the heart of any improvement, and even with technology, it's important for you to actually use evidence-based tools in quality improvement, such as a driver diagram. For example, here we aim to increase hospital-acquired pressure injury prevention interventions adherence by 30%. So we actually determined which were the key drivers in obviously the happy prevention products, dedicated time, and we also created the fundamental tactics such as conducting training days, operationalizing collaboration with the vendor so we have enough of the products to prevent pressure ulcer injury, and creating communication methods. So one of the key things that I want you to remember is that make sure that you always operationalize evidence-based practice at the heart of improvement. And also, we leverage technology as well. So we used Epic EHR, and we wanted to harness the full power of Epic in the form of reports. And we also wanted it to make it easy for our quality champions to audit through a tracer tool, which they can use with their phone. So, for example, here we created a central line data report and also quality rounding report for infection prevention. And from here, they're able to see the department, the Braden score, the Q score, sensory and mobility, the scoring, so they know which patients to focus on. And here are just some of the reports wherein we had the type of dressing. We really wanted them to break down patient care at the most fundamental level. And one of the key things as well is with Central Line, the report actually enabled critical thinking. And one of the most common questions was, why was the line there? Why was the central line there? And when our quality champion would ask the care team, no one knew why there was a central line. So it just shows that you need to go back to basics. And if you eliminate the line and it's not necessary, you eliminate the possibility for the central line infection. So those are just some of the interesting things that I realized with the implementation of this project. And we also taught them how to filter by units through our EHR. And again, going back to basics, one of the most evidence-based ways to prevent pressure injuries was turning a patient every 2 hours. So it was just very thought-provoking that when we saw the units that had high pressure injuries, none of them actually turned their patients, or maybe they had 1 or 2 turns. So it was just one of those things that once you get down to the data, you'll never know the insights you will get, because in the end, a strategy without data is just poetry. And this is just the pressure injury audit as well. And we had the bedside audit as well. And as you can see here, what we've done is one of the key principles was we wanted to make it easy for the nurse to conduct audits. So we had an app from the Joint Commission, which is an accrediting body, and they just use their phone to conduct those audits. And here are just some of the low air mattress and wicking pad. So we really wanted to know if aside from the key clinical parameters for assessment, we also wanted to see if they were actually operationalizing the interventions that were available to them. And and even we had an interdisciplinary component here as well, wherein we actually also noticed that a lot of the pressure injuries did not have a registered dietitian consult. So we really wanted to create an ecosystem behind improvement. And this was the data piece, but I also wanted to focus on the heart of improvement. So one of the key things that I wanted to create was to build community through meaningful recognition and making it fun. So one of the key pieces was that a lot of our quality champions ended up winning awards as a result of their work. So we wanted to make sure to share that meaningful recognition. And also, a lot of our quality champions also ended up being promoted to assistant nurse managers. So as you can see, through quality improvement, we actually empower nurses to advance their career and gain the skills of leadership. And also, if there's something you'll know about me is that I want to always try to make it as fun as possible. So aside from the quality champions, aside from the actual clinical work or quality work, I wanted to do something fun. So we actually had a logo making contest for quality champions. And a lot of the quality champions were very talented. So we had these logos, and this ended up winning. But what we did was we actually created pins. So now, aside from building community, we created prestige. So the quality champions would have their pins when they work in the unit. So we just created that sense of community and pride behind being a catalyst for innovation. And I wanted to share as well is that one of the key things that we wanted to establish was psychological safety. So each meeting, we had an open forum for quality champions. So I'm going to share some of how we operationalize their feedback. So we wanted them to share key highlights, such as whether they were seeing more MEPILEX or TAP system, or we also wanted them to see if there was support behind them. So for example, for this one, a highlight of the QI shift was working with new grads in the ICU on orientation with their IV insertion skills. And we also created this feedback loop wherein we enabled them to also recognize leaders who help them, such as a nurse educator and manager. And also, I also wanted to engage other leaders as well, so other executives. So one of the key things, I think a pro tip was always trying to spark joy through and empowering resilience and engagement. So for example, here a comment was, I did get some tea at night with Joseph. So aside from, because sometimes you only focus on the day shift. So whenever you're operationalizing a project, make sure you also try to show up as a leader, not just during the day, but at night as well. So I think this was at 1 a.m. and we just gave around tea and popcorn to nurses. And also one of the key things as well was we wanted them to be upfront with the challenges. So for example, one patient refused almost all cares. I'm happy to say that they had a sacral preventative border dressing of all things. And I wanted them to be as candid as possible. So one quality champion said, way to go team, way to cover our butts and our patients' butts. So it just creates, I think, by enabling them to speak their mind, we were able to secure their buy-in in the quality improvement interventions that we've operationalized. And I also want to share that whenever they have any feedback, we want to make sure to address it right off the bat. So, for example, things that they want to bring up, clarification on HD or hemodialysis line audits. And another quality champion noticed that there was no access to pressure ulcer prevention. So right after that meeting, what we did was once they said that they needed clarification and hemodialysis audits, we had the HD educator speak in the next session. And another key feedback was how can they prevent pressure ulcers when the equipment is not there? We invited the supply chain manager for the next meeting and the outcome was that instead of them having to wait on a general line to secure pressure ulcer prevention equipment, the supply chain manager actually gave a special phone number for the quality champions to decrease the time, because in patient care, every minute counts. And as you can see, this was our agenda in the next session wherein we had supply chain speak. And one of the most exciting things that came out of this project was the quality champions actually ended up creating their own educational materials for their own unit. And what we've done was we fostered an all teach, all learn philosophy, whether it's how to use the PureWick and PrimuFit or having IV tubing labeled date changes. So we really created a community of change wherein everyone was willing to share what they've created, decreasing the level of effort for the whole community. And here are just some of the early data and outcomes. Obviously, you're not gonna create incredible improvement right off the bat, wherein we did have some small wins, such as a 4% decrease in HAPIs and ND tube infections as well, and heals in pressure ulcer negative 42%. But as I've said, by being transparent to data, we were able to zero in on specific quality metrics. And here was just the central line associated bloodstream infection data, wherein we had we were below the green line as a result. But look at this from the pandemic. We had an all-time high and we tried to stabilize it. And same with the CAUTI as well, wherein we were able to reach our goals with the per 1,000 catheter days. And here is the HAPI as well, wherein from not passing for a long time to we were finally able in Q2 of 2023 to have a 1.61 rating, which is lower than our goal. And here is also the false with injury, wherein we became compliant as a result of the Quality Champion program. And here are just some of the key outcomes aside from the data. With the success, we secured support to expand from 5 units to 15 units. It also won the University of Washington Best QI Research Project. And also an unexpected thing was that it became a source of professional development, and we created a pipeline of future leaders from the Quality Champion program. And as you can see here, from that small room, we needed a bigger room wherein and from that small boardroom, we had to open 2 rooms to accommodate all of our quality champions. And aside from the quality champions as well, is that we had a special meeting engaging the managers in the quality champion work. Because sometimes one of the key, as a manager, at least in the United States, it's very difficult to secure protected time for your staff to work on quality improvement projects. So we wanted to have a separate forum for them to protect their time. And also we presented at the Seattle Nursing Research Consortium as well. So the key question was it sustainable? So I captured this data around 6 months ago. And as you can see here, from falls with injury, it just continued to decrease. And I think as leaders, for me, the main barometer for your effectiveness is, will these projects move on without you? Because as I moved on to as a co-founder now, and as you can see here, the projects and the quality metrics continued to improve long after I left University of Washington. And this is just feedback from an ICU administrator from the Quality Champions program. transformation from simple buy-in to ownership, improve nurse-sensitive indicators, and what leaders shared was that what we created was not just a strategy, but a sustainable culture of accountability. And that is the Quality Champions program, but I want to give you tangible techniques on how to leverage technology and improvement in your own careers. I think one of the key things that, especially in this age of artificial intelligence, I implore all of you to be involved in any technology implementation because we owe it to our patients. From EHR, equipment, or documentation, make sure that nursing is at the center of technological advancement because we simply owe that to our patients. Next, if you have a unit practice council or if you have the capability to join specific committees on technology such as nursing informatics, make sure to be proactive. Make sure to try to serve as a chair or project lead, regardless of your experience. Because even if you're a new nurse, there's a phenomenon called fresh eyes, meaning that there is no, regardless of how new you are, you have key insights because compared to someone who has practiced for 10 years, wherein it's just second nature to do a lot of these mistakes, you can see it from a fresh lens. So make sure to always contribute and make sure to always have a voice at the table. And also knowing your why. For me, right now, as I've said, I'm a co-founder for Carexa, which is a remote patient monitoring company, wherein during my clinical practice, what I noticed was that why are these patients getting readmitted or getting hospitalized again and again? And what I realized was that based on a process improvement methodology, the lowest rank of efficacy is rules and policies and education. In a nutshell, it's me, Joseph, who's just nagging nurses to do the right thing. But if you leverage technology such as systems, such as forcing functions, automation, and computerization, that is the highest level of effectiveness in improving care. And that is what we've operationalized at Carexa. And in a nutshell, I'm just going to show it real quick, but in a nutshell, what we have is that the common difficulty for remote patient monitoring is they normally have to have an app or there's connectivity problems. But what we've developed with my co-founder from MIT was that all patients need to do is to plug in this box and just they take their vitals as is, and it automatically auto-populates in the EHR of the provider. And that enables them to have early alerts and notifications. And it's called a vital sign for a reason, right? So that is the earliest way for providers and the care team to create interventions to ensure that the patient does not get worse. And finally, I wanted to share that even what is my why? Serving the Filipino community. So as you can see here in this photo, one of our first partners was a clinic in Carson in Southern California that had a predominantly Filipino American community. And for me, that really filled my cup. And I think that's always important for you to find your why. And an interesting thing that a patient's family member told me, wherein they said that with the Carexa devices, they said that instead of her nagging their parents to take their blood pressure every morning, knowing that the provider is looking at their vital signs, she doesn't have to nag them anymore. In fact, they actually take their blood pressure even before she tells them to. So it's just very interesting what technology can bring with patient activation. Another key advice that I have for all of you is to find your community. We're so lucky that we have the Filipino diaspora here. But in my case, I found my community wherein I'm a board member for the Philippine Nurses Association Emerald City. And also an ambassador for DNPs of color. And my why is improving health outcomes with technology through Carexa. And I implore you to follow that mission as well. Ensure that we have technology, we have artificial intelligence. We need to harness its full power for our patients. Okay, that was long, but here's just some of my key takeaways. Start small whenever you're implementing a quality improvement project. Have a proof of concept, then expand. Always use quality improvement tools because evidence-based practice is at the heart of nursing. Make it easy for nurses to do the right thing. Leverage technology. If there are steps that you can eliminate, such as paper documentation, try to do so. Data transparency is important as well so that you can monitor the improvement or if it's getting worse. Of course, spark joy through meaningful recognition. And finally, create the community and ecosystem of domain experts, executive leadership, and managers. Because in the end, we will not succeed because we believe in ourselves. We will succeed because we believe in each other. Thank you.
Thank you. Thank you very much, Dr. Joseph De Veyra, for that very insightful and inspiring presentation. At this juncture, I would like to invite everyone also to share their questions, if any, on the Q&A box, because Dr. De Veyra has really highlighted in his discussion an important reality in healthcare, and that is technology is transforming nursing practice, but meaningful innovation still depends on the knowledge, the leadership, the critical thinking, and the compassion of nurses themselves. Dr. De Vera, you also reminded us that nurses are not only end users of technology, we can and we should be active contributors in designing systems, improving workflows, and shaping the future of patient care. So there are questions already in the Q&A box. I can read the questions. Yeah. First question here is, does Carexa outsource? That's the first one.
Carexa, right now our team is expanding, so definitely in the future we will outsource. But right now we have a predominantly US team.
Okay, thank you. So another question
But
from
please add Carexa as well, so you'll see if there are any job openings. Maybe I'll put the Carexa site here on LinkedIn. So make sure it would be an honor to collaborate with any of you. And you can also message me on LinkedIn as well. So please remember I'm always at your service.
Thank you. And another question, do you know how to obtain a demo of a free HR system that is similar to Epic, to practice Epic? And it also doesn't have to be Epic, but maybe some free open source option.
I think there's a lot of we only used Epic in the major healthcare systems in the United States uses Epic, but the I think especially with artificial intelligence, it doesn't have to be these high-end EHRs. I think the even the EHRs that are made by startups can have a higher degree of effectiveness and operationalizing improvement. But let me look into that, and I'm sure there are a lot of EHR systems that can assist you.
Thank you. Another interesting question here. With the growth of remote patient monitoring and cross-border virtual nursing, how can nursing leaders ensure innovation does not unintentionally create workforce inequities while still protecting patient privacy and maintaining consistent standards of care?
I think the key there is that is why I want all of you to be involved. nursing needs to be at the center of any technological innovation. Because the problem is what ends up happening, or what I've heard, at least my other chief nursing officer colleagues said that the nurse is the last one to know about the technological innovation. And how can we combat that? We can combat that by creating these councils, these unit practice councils, and also making sure that your voice is heard. Is this technology actually improving our lives? Are there additional steps? And also be patient advocates. When you see, how is this data being captured, or are they being analyzed? Is the patient confidentiality being protected? So make sure to ask yourselves that, because at the end of the day, you are the safeguards of patient care. You're not merely nurses. We're not just here to do wound care or start IVs. We're here to protect our patients. And that is why I implore all of you to stay involved.
Thank you. Again, we are the safeguards of patient care. We're not just nurses doing mechanical tasks. Another question, in situations where remote patient monitoring detects abnormal findings, this is about Carexa. How does Carexa ensure that alerts are clinically prioritized to avoid alarm fatigue among healthcare providers?
We decrease the level of effort by triaging, and we also create a report every morning wherein we actually don't bombard a lot of the providers with each alert. We take into account the baseline and the trends of the vital signs to ensure that those alerts are appropriate. And also, one of the key things as well is those clinical parameters. It's not set on general clinical parameters. We actually collaborate with the provider to ensure it's not just the clinical the common normal findings, but they take into account the patient condition. So instead of it creating alerts for 140 over 130 or 140 over 90, sometimes some patients need a higher blood pressure clinical parameter. So we collaborate with not just physicians, but nurses and nurse practitioners as well to set those alerts.
Okay, and there's a question here from a fresh new graduate. The question is, what are some tips you can give to all new nurses that's still struggling to get the flow of patient care, like using machines and doing bedside care?
I think, honestly, and correct me if I'm wrong, Dennis and Dr. Jerome. Honestly, I think you can't beat experience. You really just need to show up every day, create. I mean, for me, right? Like what I have here is I still write everything on a checklist. Like it doesn't have to be technological. So I was still when I was on the floor, I would create these checklists that all everything I because a lot of it is not just the skills, but the time management. So for me, having those checklists was very helpful. So it doesn't have to be super complicated. Sometimes you need to meet nurses where they're at as well. So sometimes that S bar or highly complicated forms might not work. So maybe something more visual will work for you. But sometimes it's only through experience that you'll see what will work for you. And for me, a simple checklist always helps.
Thank you. Very good advice. And I would agree with that one. Just show up and learn from the process.
Yes.
There's another question. What technological competencies do you think nursing students, so this comes from a nursing student, what technological competencies do you think nursing students should start developing now to remain globally competitive in the ever-changing modern healthcare settings?
I think before the technology, you really need to make sure that you're adept with your head-to-toe assessment and if these are new grad students, make sure I know this is probably going maybe a step back, but make sure to study all your physiology, anatomy, because you can't know dysfunction without knowing normal function. So you really need to get back to the basics. So, and make sure that whenever you're doing focus assessments and head-to-toe assessments, it all starts with nursing assessment. And from there, you can document, you can determine if a patient is going downhill, and it's only then that you can leverage technology. For me, it's really going back to anatomy 101 or physiology, pathophysiology. And with regard to technological competencies, I think studying whatever EHR you have and ensuring that you're compliant from a documentation standpoint. What are the regulatory needs of the hospital in that you need to document in order to be competitive? Because if you can share that I've created head-to-toe assessments and also be involved in creating those documentation as well. In the event that you notice, I noticed that the Braden score is not being documented for happy prevention nursing note. So make sure to say that, because aside from, it's not just about being compliant, but how can you add value at the clinical setting as a nurse. Remember, regardless, new grad, veteran nurse, we are all leaders in the clinical setting. So make sure that you're proactive in improving patient care. That is how you will set yourself apart.
Thank you. So again, to the newly graduated nurses, the new nurses, the nursing students, go back to the basics and show up. Another question, what legal liabilities exist if a remote monitoring system fails to detect patient deterioration in real time, and how should accountability be shared between healthcare providers and technology companies?
It's a shared accountability model because our algorithm and machine learning detects the alerts the provider that have whenever a blood pressure is outside of the clinical parameters. It's a shared liability because at the end of the day, we are a care team, so it is a shared liability. But ultimately, what we do is when we're able to see the alerts as well if the provider is intervening or not. So we actually create a secondary alert that is provider specific outside of the patient. So it's almost that there's an escalation pathway from the patient to the provider, and sometimes we would go straight to the administrator as well. By having these escalation pathways, that is how you decrease liability.
Okay, thank you. We have lots of questions here. So a lot of people has been very interested in the discussion. So there's another question about Carexa. What specific endpoint security measures prevent malware from spreading from a nurse's mobile device into the broader EHR system?
We have the highest level of security and accreditation. We're HIPAA compliant, and we have a GDPR compliance as well. So it's actually, that's what keeps me up at night, the security. And for us, we really ensure security by, for example, for something as simple as taking a screenshot of the patient record. Under our platform, we don't allow that. So by creating these, again, going back to those hardwired stop points like forcing functions, that is how you ensure security.
Thank you. And yeah, you mentioned earlier also about AI. So the next question is about AI. So with AI supporting tasks such as patient prioritization, lab review, referrals, and ECG monitoring, how individualized are these recommendations to a patient's specific clinical context versus being primarily protocol-driven or algorithm-driven?
So that's the magic of AI, right? So the AI model becomes more powerful the longer the patient is under your care. So at the more data you feed into it, the more trend. So the more a patient stays with a specific organization, the more it can predict when a patient is going downhill. So that is actually that is what excites me, because we're gonna have greater predictive capabilities the longer we use AI in our systems. So
Thank
it's gonna be customized. Like there's no more so obviously it can be population specific as well, but the
Mhm.
longer you use AI, the smarter it will get. And for me, it will improve patient care in the long run.
Thank you. The next question basically is more on your achievements as an individual. You have achieved so much academically and professionally, including experiences connected with institutions like MIT and Harvard. What mindset or habit help you consistently pursue opportunities at that level?
I I think it's always not always saying yes to any opportunity. I remember I was at the doctorate level already, and my mentor was asking me, "Hey, make sure to be a part of this committee." And I said, "Oh, I'm tired. I have 3 jobs right now. I want to sleep." And then what she told me was that, "Remember, Joseph, you're an immigrant. No one will create opportunities for you. You need to seek them out." So for me, the things that I always regret is the opportunities that I did not say yes to. So if you can push yourself to just say yes to all of those opportunities, do so. And also for me, like staying happy, like finding joy in whatever you do. I mean, it's gonna get stressful, but always staying positive and staying cool for me, like exercising, trying find actually nursing is inherently difficult. So always find that one thing that fills your cup, whether it's jogging, exercising, maybe eating lechon or sisig. I mean, not all the time, obviously, for cholesterol, but always find that thing that fills your cup to push you forward and do that activity when you're starting to feel down. But for me, just a positive mindset. I think that is what will push you through those difficult periods.
Thank you. And also, linking the next question to what you have mentioned. It's not in the chat, but this is something that we're thinking. Like from what you have presented earlier, you have already led nursing across clinical operations, technology transformation, and workforce innovation. So looking back on your leadership journey, what was one difficult decision that shaped you most as a leader? And what lesson from that experience should emerging nurse leaders carry forward?
I think a part of it is sometimes you will have to make unpopular decisions. And I'm sure we've been through all those meetings wherein we were the ones who were we were the flavor of the month. But I'll give you an example. That's why I mentioned it during my experience. During the pandemic, we were short-staffed. We were
Mm.
short-staffed. And the problem with the Quality Champions program was that they needed protected time to conduct their work and to attend those meetings. What does that mean? Despite being short-staffed, I had to tell these managers that quality improvement work is innovation is important enough for them to be short-staffed or maybe pay overtime. And that was an inflection point. And what we did was the important piece was I promised them that they will have improvement as a result of the Quality Champion program. And as a result, we did. So it's more of a negotiation. And also a part of it as well is communication. So when you're managing a level 1 trauma center or any hospital, one of the key difficulties is sometimes there's a patient advocacy component of nurses at the front lines wherein this patient should not be discharged yet. And it's about finding how can you communicate it, that how can you meet them where they're at to secure their buy-in. So for me, what I would tell them is that it's not really we're discharging them prematurely, but it's reallocation of our resources to handle our mission. For each bed that is there, there is a sicker patient who came from a car accident who needs that bed more. So it's not really us discharging patients prematurely. What will preserve our mission? And what will preserve our mission is efficiency in utilizing our resources. So reallocation of resources to serve the sickest of the sick. So finding those ways to communicate and touch your staff is the key. And also smiling. I think humor also helps for me. Corny jokes.
Yeah, thank you. Also in relation to that, because we're moving towards more personal and professional things that from your experience in both clinical leadership and healthcare education, what do you think is the biggest challenge that nurses face in adapting evolving healthcare technologies? And from that perspective, how can nursing education better prepare future nurses for this reality?
I think the hardest part is adoption. Remember, when a lot when you're in the unit, the problem is if you're a new nurse, you will see sometimes it's even the veteran nurses are not going to support these technologies. So make sure you're at the forefront of adopting and supporting them and assessing them. For educators, I think what we need to do, so last week I was actually presenting on artificial intelligence in Rutgers University. Make sure to invite not just experts but people who have implemented these technologies and are using these technologies into your programs. Integrating that open forum so that they know what they expect once they're in the clinical setting, and if they can actually practice, or if you can integrate the utilization, so maybe they can practice with the EHR or with the remote patient monitoring or even a mock platform. Trying to simulate those experiences during their education would go a long way.
Thank you. And in the questions Q&A box, there's a lot of interest basically on Carexa. And as you have mentioned earlier, you're inviting everyone also to follow you on LinkedIn and look on Carexa for opportunities. And we also encourage the participants to really connect with Dr. Joseph, because from this discussion, I think he's very much interested to work closely with all of us as we navigate the technology-driven healthcare and as we move forward in providing really an improved patient outcomes. So maybe, Doc, for the last question for you, if there's an advice that you can give to Filipino nurses, whether they live in the Philippines or they want to venture outside of the country, what would you tell them?
I think going back to what I said is to make sure to be open and say yes to as many opportunities as you can, because you don't know where it will go, right? So for example, for me, when I was working on a readmission reduction project, actually working as a CNA or a caregiver, I was taking vital signs of patients, cleaning, and I had to write it on a piece of paper, and then I would lose the paper, and I just realized there should be a better way. So for me, deciding to be a caregiver and taking those vital signs early on my career, create that always stayed with me. What these vital signs, it's gonna be in my pocket. No one's gonna know about it until maybe we document, or maybe the next day and something bad could have happened. So no opportunity is too small for you to say no to. So have that humility to say yes to those opportunities, because you can connect the dots moving forward. You can only connect them moving backward.
Thank you. Thank you very much. This has been a very interesting discussion. And thank you very much, Dr. De Veyra, for sharing your insights with us. At this point, I would like to do some announcements from the organizing committee. we have observed that there are questions related to certificates. So we would like to inform all participants that this webinar has been applied for CPD units here in the Philippines with the PRC CPD Council for Nursing. So to qualify for the certificate with CPD units, all participants are required to accomplish the evaluation form, which will be made available at the end of this webinar. Please note that the certificate with CPD units will be available through the WCAA platform within 2 to 4 weeks after this webinar. So thank you very much for your participation and cooperation. So we have around 800 participants here. And at this point, I would like to take this opportunity also that from the Pacific Nursing Service Organization, one of the co-organizers of this webinar, we are pleased to announce our upcoming Philippine International Nursing Symposium 2026. You can see the poster on the screen right now. We would like to warmly invite everyone to attend the symposium on November 25, 2026, June 25, June 25, 2026 at the National University Mall of Asia in Pasay City. So this symposium will bring together nursing professionals, educators, researchers, healthcare leaders to share research innovations and evidence-informed practices that advance nursing, healthcare, and global health. We also encourage interested participants to submit abstracts for poster presentation. The areas for research on the abstracts would be nursing practice, nursing education, and global health and health systems. So deadline for abstract submission is on June 5, 2026. And we would like to request everyone also to follow the official social media pages of the Pacific Nursing Service Organization, the Filipino Nursing Diaspora Network, the WCEA, and of course, Dr. De Veyra's LinkedIn and Carexa. So thank you very much. At this juncture, we are already at the end part of our webinar. So to formally close the session, we would like to invite a distinguished nursing leader to deliver the message. Let us all welcome Dr. Patria Manalaysay. She is the president of the Pacific Nursing Service Organization for her closing message.
As we conclude today's 2026 Filipino Nursing Diaspora Day webinar, we extend our heartfelt appreciation to everyone who dedicated time to participate in this important gathering. Today's discussions reinforced an important message. The future of healthcare will require nurses who are not only clinically competent, but also technologically informed, innovative, adaptive, and courageous leaders of change. The theme, empowering nurses to lead, innovate, and improve patient outcomes through technology, reminds us that healthcare transformation is already happening. Filipino nurses across different parts of the world are contributing to this transformation every day through bedside practice, leadership, education, research, policy, entrepreneurship, and technological advancement. We extend our gratitude to the Filipino Nursing Diaspora Network, the World Continuing Education Alliance, St. Anthony's College, St. Paul University, and our distinguished speaker, Dr. Joseph De Veyra, for helping make this event possible. As members of a global nursing community, let us continue strengthening collaboration across countries, institutions, and sectors. Let us continue mentoring future generations and advancing solutions that improve health outcomes while preserving the compassionate foundation of nursing practice. May today's conversations become tomorrow's innovations. Thank you for your participation, your leadership, and your continued service to humanity. Maraming salamat po at mabuhay ang mga Filipino nurses sa buong mundo.
Thank you very much, Dr. Manalaysay, for your inspiring closing message. And to our speaker, Dr. Joseph De Veyra, thank you once again for generously sharing your expertise, experiences, and insights with us today. To all our participants, maraming salamat and thank you for being part of this meaningful learning session. Today's webinar reminds us that the future of healthcare requires nurses who are innovative, adaptable, globally connected, and deeply committed to patient-centered care. May today's discussion continue to inspire all of us to lead with competence, compassion, and courage as we navigate the evolving landscape of healthcare and technology. On behalf of the Filipino Nursing Diaspora Network, St. Paul University Iloilo, St. Anthony's College, Pacific Nursing Service Organization, and the World Continuing Education Alliance. This has been Dennis Amando, the Vice President for Engagement of PNSO, your moderator. Thank you again. Thank you very much, and have a wonderful day ahead.
Thank you so much, Sir Dennis. Let's have a group shot, please. With Dr. Joseph and the rest of the team. That was an inspiring webinar, Dr. Joseph.